Well, school is officially back in session for most Idaho kids, but as students head back to the classroom, it's important to make sure they're up to date on their vaccines. Joining me now to talk about this is Dr. Erica Aragona. Thanks so much for being here today, Doctor.
Thanks, Matt. Happy to be here.
All right, good to hear. Now, as we are now back in school for, I think, all school districts pretty much in the area especially, why is it so important, would you say, for children to be vaccinated?
You know, vaccines are a great and effective way to prevent severe disease, really by increasing your body's natural immunity. And what I like to tell parents and kids is this allows us to have those stored antibodies so we can fight something right away instead of playing catch up to something maybe our kids have never been exposed to before.
Gotcha, that makes sense. Now, this is I don't know if we've really talked about this next question much, but is there an age range where students might be more susceptible to illness if they're not vaccinated?
You know, as a board-certified family medicine doctor, I take care of a lot of babies all through age 99 or higher if I'm lucky. But what I tell parents is all ages are important. Yes, you know, babies, newborns who aren't age eligible for certain vaccines are kind of at a higher risk of certain things because they can't get the vaccine yet. So if they have older siblings or people that are going in and out of the house that might bring something back to them, we want to take that into consideration. But really, all ages matter. So our goal is to increase the body's ability to fight disease at all ages effectively, again, before exposure, and really decrease transmission to other people. That's really what we want to focus on.
Yeah, that makes a lot of sense, and I think you just kind of got into a little bit got into what I was going to ask next. When you might have vaccinated or unvaccinated kids coming back into the home with young children, but what about inside the schools? How exactly does vaccination help with inside those schools?
Yeah, well, school started. I mean, we're gearing up for it. And we know, even pre-COVID, right, close exposure in an enclosed environment really can cause more things to spread quickly. So it's really good to have an awesome offense. And I tell kids, let's play that defense. We're going to focus on sports, get them excited. Let's make it manageable to them so they understand. So I tell my pediatric patients, we're going to get shots because we want to protect you before anything happens. So if you get sick, your body's already ready to go. And I think parents need to hear it that way because it's really scary to send your kids back to school, definitely during a pandemic when we're trying to keep everybody safe. So if we can really protect them early before exposure happens and hopefully cut back on transmission, we're doing our job effectively.
Yeah, sounds like the best way to do that. Now, unfortunately, we've heard about a couple cases around the country of things that we thought had been eradicated diseases, such as polio. Heard of a couple of things from that, and of course, that's because vaccines have been down nationally. So why would you say vaccines are so helpful or important, not just in school, but for the kids outside of school?
Wow, that's an awesome question. I think we really do want to focus on the word eradication. How cool is it to be able to say to someone, we were able to get rid of a disease, at least to prevent it from spreading into our community. So because you mentioned polio, we first developed that vaccine back in the 60s. We were able to say that we didn't have a strain come from the US since 1979 and full eradication in the 90s and early 2010s era. The new strain that came out was found to be in a person in New York City who wasn't vaccinated. And that's the drive home point is diseases are still around. But what we want to do is protect our bodies by playing, again, a really good offensive game where we can go out into the community and not be afraid to contract something. So how does it help outside of school? Our kids are going to be in the communities. We're going to be in the communities. We want that. We want an engaged community. We want to have fun. We also want to protect ourselves and not have that worry that we might contract something. And we do know that there's evidence to say if you've been vaccinated, it dramatically decreases the risk of getting super sick or dying or getting hospitalized. We want to keep ourselves as safe as possible and still have fun.
Gotcha. Great points there. All right, Doctor, we're just about out of time. So for anybody or parents that want more information regarding immunizations, where can they go?
Wow. Well, first and foremost, always ask your pediatrician or family medicine doc. They know your child best and their needs, and they can make recommendations specifically for them. But for parents, I really like to go to the CDC for up-to-date information. You've got the Department of Public Health. You can go locally or online. But the AAP, so AAP.org, that's the American Academy of Pediatrics, save that one for anyone watching. It is amazing because it has lists and explanations of what your child would need and when, and really breaks down vaccines and what they do. So I'd start there.
Perfect. All right. Joining me this morning has been Dr. Erica Aragona with St. Alphonsus. Thanks so much for being here and the wonderful information.
Thanks, Matt.